And good morning, welcome back. I'm Mabel, Jong. This is WHCC TV coming to you live from Washington, D.C. At this meeting, we're talking a lot about different technologies and hospital organizations and their investments in certain tools and what is the right method in shopping for these kinds of tools. Right now I have in the studio Crystal Duggar, who's Vice President of Clinical Operations at Sarah Cannon Research Institute at HCA. We're going to talk about artificial intelligence. Good morning to you.
Good morning.
Thank you so much for joining us.
Yeah, thank you.
Let's first get a sense of what the Sarah Cannon Research Institute is of HCA.
Sure. So Sarah Cannon Research Institute has been around for about 25 years. They do tons of research, first in human research. They have tons of drug development units, or the most in the world, across the United States and actually internationally. But then about 10 years ago, HCA came to Sarah Cannon and asked them to manage or lead their health service line. And that's really what I do. I'm a nurse by training, and I also have my MBA. And I walk into our 180 hospitals across the United States, and then also 5 in London, and assess their programs, identify opportunities, ensure we have quality, ensure we have analytics, scorecards, dashboards to really assess our programs and make good clinical decisions to improve efficiencies, operations, financial, but most importantly, quality for our programs.
Okay. The approach by hospital organizations now and other healthcare companies with technology is they're trying to find great solutions, but maybe going about it the wrong way. You do feel that where you are, you've gone about it the right way.
I hope we have. What we have done is we actually have a phenomenal HCA IT team, and I'm very proud to work in collaboration with them. And so what they've allowed us to do is walk into meetings together and truly brainstorm, here's our problem, what solutions could resolve that problem. Instead of, I think many programs are, they see the sexy equipment, artificial intelligence, wearables, chat boxing, all these types of things, and they want to just use them in some way instead of saying, here's our problem, how do we fix it? And that's really what our team did. And it just happened. We have a lot of tools that maybe aren't live streamed as often, but they solve a lot of our problems. This one truly is one that a lot of people are paying attention to, because we have found a way to use artificial intelligence in our world, in our world.
What was the problem that you identified that you were trying to solve?
Yeah, well actually this is one that many, even hospital administrators do not realize this is the case. So about 60% of the surgical volume in a hospital system is from oncology. That's not always the standard, but around 60% for most of our programs. And a lot of those patients, when they're diagnosed, when a patient's diagnosed with cancer, they're not sitting in a hospital bed. It's usually an outpatient procedure, and then they go home, and then 2 to 3 days later their pathology report is read and they're called about their cancer diagnosis. And you can imagine if you're sitting at home or at work or wherever you are in your car, and you're called and told about your cancer diagnosis, that shock and all the emotions, not sure where you go next. You need someone there to help you walk through this process, a coach per se, that understands the healthcare system, that understands oncology, that understands that patient's pathology report, and then understands the emotional needs of that patient and their family at that time. And so our problem was, we wanted to be there at that very moment whenever a patient was told they had cancer, but if they weren't in our hospital, we didn't even know they existed. That pathology report went to whoever ordered it, their primary care, their gynecologist, their pulmonologist, their gastroenterologist. But then if it was sent to them, it wasn't sent to the hospital too. They weren't aware that to follow up. So now we identified a tool, AI tool, using natural language processing that reads through all of those pathology reports and sends them straight to a nurse navigator who can open up their computer and see a work list of all the patients that were diagnosed that day or even in the last 10 minutes, and they can immediately respond to that patient's need, call them, call their doctor, get a plan in place, and start that patient on the road to recovery.
Wow, that sounds like such a game changer. It sounds like what people would want.
It has been, and I think you'll get to talk to Dr. Gear a little later, but he can really tell you some of the patient experiences. You know, as you imagine, when someone's told that they have breast cancer or lung cancer, the doctor's mouth keeps moving, but they don't hear anything else, you know, and they're terrified. And to really be able to take that patient when they're spiraling, I call our nurse navigators our angels. You know, they truly love these patients, they care for these patients, and they're doing the right thing, but it happens to also help the hospital organization, because when you build trust and you care about someone and you do the right thing, then the patients tend to stay in your system. They tend to want to stay with that navigator, even more so sometimes than their physicians. They want to make sure that navigator is a part of their life and is helping work that patient through the process.
The relationship is so deep by then.
So deep by them, and they're with them throughout the whole treatment. You know, in a community hospital, 82% of patients are treated in the community setting, and so academic hospitals are wonderful, but they're only in certain places. And when you take a patient out of where they go to church, where they have community support, where their family lives, where they have friends, then where their children go to school, you're removing them from all of their support system. And if we can treat a patient close to home and ensure that they're getting the Sarah Cannon clinical trials and clinical research, but also that a great surgeon, a great medical oncologist, great radiation oncology, and we can walk them through that process and make them be there through all those points of care where all this care isn't in one building. We're truly coordinating all that care for them, and they don't have to think about that. It's a game changer for both the industry and for the patients alike.
So enter in Digital Reasoning,
Yes.
the company that is behind the technology
That's
that
right.
you ultimately chose.
That's right. So we actually worked with a couple companies, and Digital Reasoning has been a great partner. They weren't trying to solve the world. I think many times a AI company in healthcare is trying to replace physicians, and instead of having a physician read a scan, they're trying to find a solution where a tool reads a scan, and that's actually not what we did. Our physicians are an integral part of what we do. They're key to our programs, and we believe that a physician behind the diagnosing and treating a patient, we want that. So we try to make sure all of our patients go through multidisciplinary conferences and have that physician expertise and specialists together. But what the tool did was it read the reports that were being submitted, and it was able to coordinate those reports and send them. If it reads a report in Nashville, Tennessee, that comes through a server that says that the patient has breast cancer, is located in Denver, and is closest to Swedish Hospital, and the nurse navigator is Cindy, it can immediately send it to Cindy, and she can start to help working that patient through
And
the
was
system.
this a product that Digital Reasoning had already developed, or did they customize it to the needs of Sarah Cannon
Great
Research
question.
Institute?
So they, no, they had not developed this yet, and I do think HCA brings a solution for AI. So one of the things about artificial intelligence and digital reasoning is you have to have a lot of reports to train the system. And when you think about a one hospital organization, even though they have a lot of patients, it's nowhere near millions of reports. So it's nowhere near the reports that you can have to train this system. On top of that, HCA really invested, and so they didn't just put IT on it, they also put nurse practitioners, so training the system, reading the reports, ensuring that it's reading it correctly, sending it, having a feedback loop to retrain when it got things wrong in the reports. So they really invested with digital reasoning together, and they had millions of reports going from 180 hospitals across the United States feeding into this system. With the clinical and all of that mass volume going into the program, they were really able to find a solution. It would be really difficult for other programs to work with a digital reasoning to develop that internally, but together we can do this. This truly is a digital reasoning can't win without it, HCA can't win without it, but digital reasoning and HCA together has been a great solution for our programs.
A true partnership.
Yeah, true partnership.
So Crystal, you're going to be talking on a panel later on today. What are the messages or the message that you want to leave with attendees from that discussion?
Well, two things. I want them to understand the problem. So most CEOs, when you think about cancer, unlike, let's say, orthopedic, whenever you break your leg, you go to an orthopedic surgeon, they resolve that, you might go into the hospital, and then you go home. But when you're diagnosed with cancer, or you have a baby that has a fetal abnormality, a congenital abnormality, then things like that are so complex, that woman or that cancer patient is going to have many physicians, and they're going to be in the system through there's going to be downstream revenue that comes into the hospital. There's going to be tons of opportunities for you to do well or not. And so understanding the complexity of these programs that have a long continuum of care and why you have to identify that patient early, both operationally, financially for the hospital system, because you'll lose that patient. When a patient's scared, they go to Dr. Google and they start researching everywhere on where they should go. And it may not be your center, it's whoever marketed the best on the internet. And so really ensuring that patient has the right clinical care is going to be that solution. And the only way you can do that is knowing they exist. And the only way we have found to do that is through a tool like digital reasoning and AI technology.
Thank you, Crystal.
Yeah,
I
thank you.
look forward to speaking with your colleague a little bit later, Dr. Richard Gear, on how this has really impacted the patient. I appreciate your time.
That's great. Thank you.
Thank you, Crystal.
Thank you.
Crystal Duggar of the Sarah Cannon Research Institute of HCA. Stay tuned. We'll be talking with Dr. Richard Gear in a moment.